let's get more now on prevention and control of the virus from an infectious disease expert. Gavin Macgregor-Skinner has worked with governments, the United Nations, private sector and militaries, and has designed public health and disaster response programs, including for Ebola. Gavin, thanks so much for being with us. Let's start off with one of the primary ways people in Hong Kong are, what they're doing is using masks. There's been a huge mask shortage as well that we've had. Do you think, A, the masks are effective? And if yes, how can someone make them last longer?
That's a great question. The masks create awareness. So people are aware of and improving personal hygiene when they wear a mask. Are the masks effective? Well, if there's gaps here on the sides, maybe not 100% no. But what we're trying to do with the mask is to prevent you from putting your hands on your face, protecting your nose and your mouth. But one of the things I see when I walk around Hong Kong is people are adjusting their masks all the time with their hands. That has to stop. The idea of the mask is to protect the face from the hands. Also to protect any droplets that might be coming from someone who's coughing and sneezing. And as you walk around, if your mask is itchy and it irritates a little bit, don't use your hands. Just put up with it. Be tough, be hard. Don't put those hands to the face.
All right. So what can one do to make the mask last longer? Do you think it's, because it's suggested that you should use every mask only once, and like if you take it off to eat, you should throw it away and use a fresh one. But given the shortages in the city, that's not necessarily possible, and we might have to reuse. So would you advise that? And if yes, what can one do?
The reality is, yes, there is a shortage of masks. But I see people wearing masks out in the wide open areas, in the parks, on the streets, where there's no one else around them. They're wasting the time in that mask, because as you breathe through that mask, you make it wet. And when it becomes wet, it loses its effectiveness. So the important thing is that wear the mask when you're in a crowded area, when you're around people, like when you're on a bus or a train or a taxi, wear the mask. Maybe when you're in the office, wear the mask. When you're not wearing the mask though, don't touch the outside or the inside with your hands. Use the loops here. Take it off. Don't put it down on a table. If you have a bag, put it in a bag and protect the mask as much as you can, because as the mask protects you, you also have to protect the mask, and that's really important.
Right, and in terms of personal hygiene as well, any particular, recommendations that you have for people, for themselves, as well as, how you're cleaning or disinfecting your house or the area that you're in?
Exactly, like any virus that causes respiratory infections, that causes a chest infection like colds and pneumonia, there are certain things that every person, every individual can do. Wash their hands with soap and water, but they need to wash them for 20 seconds. They need to wash the fronts, the backs, in between the fingers for 20 seconds. And that's really hard because most people wash them for much less than that. We need to also protect ourselves and others when we're coughing and sneezing. So we cough or sneeze into our sleeve or our elbow. Not everyone does that. And it's really important that if we're outside and we're wearing our clothes and we've been in areas where people may be coughing and sneezing, then when you get home, take those clothes off and wash them every day. And then put some clean clothes on to walk around the house. So you don't bring any outside contaminants or any outside viruses into your house. That's really important. And so if more people do that, we'll start to see, hopefully, better protection. May not be 100%, but it's better than nothing.
Absolutely. Thank you so much, Gavin, for joining in and giving us more insight on the steps that we can take to protect ourselves and the people around us.